As the disease progresses, you'll be seeing other changes, which are other motor symptoms. You'll start to notice that your loved one is going to have something that we call a freezing episode. And a freezing episode is any time that all of a sudden they're unable to move. They could be walking and all of a sudden they sort of tip forward, and even though their mind is telling their leg to move, it doesn't move. Sometimes these can last 5 to 10 seconds, sometimes they can last 3 to 5 minutes. The most important thing is to just stand there and to be patient and talk to your loved one. As this happens, maybe you can clap, you can put on some marching music. Music is a huge way to help them. All of a sudden they'll hear that strong beat and it helps them pick up their leg and continue to move. So if you are seeing increased freezing episodes, using music, especially marching music, is going to be a way to help them be successful. A mask-like expression is something that can be really hard for caregivers. Let's say that your spouse or your parent is somebody that's been extremely animated their entire life. Lots of different facial expressions, lots of smiling, lots of laughing. Please know that as they change and progress through this disease, they're going to have a mask-like expression. So when you're telling a story, when you're telling a joke, when you're telling something that's important to you and you want them to be excited or happy, you're going to look at their face and you might not get the response that you're hoping for because you'll just see just a straight mask. Remember, that doesn't mean they're not thinking that, they're not feeling that. This is the disease and this is what they're showing you, but please know that underneath they still have those feelings. It's an adjustment and you just need to learn that that's still inside of them even though they can't physically show it to you. Unwanted accelerations. We talked a little bit about freezing as people are walking. Well, it can also be the opposite way. They may have freezing episodes and all of a sudden they're able to start walking, but oh my goodness, they're walking very fast. They have a walker, they have these little steps, and they're almost running down the hallway. This is a time to get in front of the walker to help hold the walker, and this helps them slow down. What happens when somebody walks extremely quickly and they don't have good balance can result in a fall. So always walk next to your loved one. The stoop posture we did talk about. As they walk, they tend to increasingly stoop more and more and to lean forward. That's why walkers are wonderful. They can help that person put their hands on the walker, put their shoulders back, and stand up straight. It's okay to cue your loved one to do that. When they walk, they have all of these different things going through their mind. They're just trying to make it through the day. They're just trying to walk from their bedroom to the table. It's your job to cue them to stop, to stand up straight, to put their shoulders back, and to help them with their balance. Difficulty swallowing. This is typically something that doesn't happen until later on in Parkinson's, maybe the 4th or the 5th stage, but watch for difficulty in swallowing. You may have to cut up pieces of food. You might have to change textures, do applesauce, things that are softer. Sexual dysfunction. As the disease progresses, it may be very difficult for your loved one to actually be sexually active, or at times they may be sexually inappropriate, which is something that we'll be talking about later when we discuss behaviors. And lastly, drooling. This can happen from Parkinson's, but oftentimes it actually happens because of the medications that are treating the Parkinson's. Oftentimes the drooling will be just through one side, sometimes both sides of the mouth, but for quality of life and to have them feel good about themselves, you want to make sure you have Kleenex, that you have a handkerchief, that you have a cup, that you're there to assist them with getting the drool or anything that's coming off their face so that they can still feel good about how they look, so they can still feel confident.